Glad you're with us here on this Wednesday afternoon. I'm Michael Aaron, meteorologist Nathan Scott over in the Weather Center talking about the possibility of some winter weather later tonight, early tomorrow morning. Nathan, tell us what we need to know.
Well, Michael, it's pretty warm out there right now. Temperatures approaching 60 degrees at Little Rock, but notice the cooler air waiting in the wings in North Arkansas. Temperatures are into the upper 30s. A front is slicing its way through the state at this time. Got some high clouds to the north, and that colder air is going to continue to bleed its way in here throughout today, but especially into tonight. And temperatures dropping down into the upper 20s to lower 30s. Moisture moves in from the south. And we're going to have the potential of, yes, some winter weather. So here's the breakdown. I think the best lifting of the atmosphere and the best amount of moisture will be in northeast Arkansas and north Arkansas. That's why I'm saying winter weather is likely in the blue from Mountain Home to Newport, Jonesboro, also towards Memphis. But here in central Arkansas, all the areas in the pink from Pine Bluff to Dumas, Stuttgart, Little Rock, Conway, Russellville, and off to the north, we will have potential. We could see a little bit of snow, a little bit of freezing rain, a little bit of sleet. No accumulation is really expected, but it does not take much for it to cause some road problems. I'll have more details on that, the timing, and who could see some accumulating snow coming up.
And of course, we'll be keeping a close eye on the situation overnight into tomorrow morning. So now is a great time to make sure you have downloaded and have the latest version of the THV11 app. It is packed full of weather information. You can catch up on our post and video forecast from our THV11 weather team. It's a free download in the Apple and Google Play stores. Want to get to some developing news in Pennsylvania this afternoon. At least 13 people are dead and several others hurt after an early morning fire in Philadelphia. According to the city's fire department, it happened inside a duplex that houses 2 apartments. Officials are calling it one of the worst incidents they have responded to. No word yet on what may have caused that fire. Stay with us here on THV11 and our digital platforms. New at noon, students and staff at Arkansas Baptist College must get vaccinated to return to campus this semester. All employees and students have to have their first shot by today and both doses by February 10th. There is an exception for pregnancy, medical, and religious reasons. The push comes as Arkansas continues to see a surge in new COVID-19 cases and hospitalizations. Yesterday brought the biggest one-day jump in infections we have ever seen. The state reported 6,062 new cases. Not only is that a record number of cases, but our positivity rate is also at an all-time high. In reality, these numbers that we're seeing are likely even higher. That's because of people testing at home or people who were infected but have not been tested. Another record and a bad one. Active cases are also at their highest in Arkansas, sitting just above 32,000 right now. Meanwhile, 775 people are fighting COVID from a hospital. That's 53 more than Monday's total. Governor Asa Hutchinson called this surge one of the greatest risks and challenges we've ever faced during the pandemic. He's now bringing in even more reinforcement to help with the massive demand in testing and getting a plan ready should hospitals start reaching capacity again. But despite all of that, Health Secretary Dr. Jose Romero shared there's something we have most Arkansans could not get last January, and that's vaccines.
No, it's never too late to get vaccinated. If you couple your vaccination with your physical mitigation measures, you can get through this.
Back to those plans the governor has for the ongoing surge. He says right now those are more reactive to the demands of the virus, reassuring the public that he is not going to declare an emergency just yet. Instead, the governor says he's going to see what comes in the weeks ahead. Hospitals and pharmacies are not the only ones struggling to meet that increased testing demand. Stores are having a hard time keeping at-home test kits on the shelves, but help is on the way. President Joe Biden announced he will be distributing 1.4 million at-home test kits to the natural state. Governor Hutchinson says he's not sure when those kits will arrive or how they'll be distributed. Unfortunately, those tests are about to get a little pricier depending on where you shop. Kroger and Walmart are raising the prices of their testing kits this week. Last year, both stores pledged to sell kits made by Abbott Laboratories at cost for 100 days to expand testing options for Americans. But now those 100 days are up. Consumers will start paying at least $5 more depending on the store. Some good news, though. We're starting to see more testing clinics pop up around the natural state. McCain Mall is partnering with the COVID Clinic to provide free drive-through COVID-19 testing from now until April. Again, free. They're offering several tests, including rapid PCR, rapid antigen, antibody, and flu tests. The clinic is open every day from 9 until 5 in the north parking lot behind the movie theater. All you're asked to do is make an appointment on the COVID Clinic's website. Nationwide, the CDC is warning hospital admissions and deaths will likely increase in the coming weeks as the record-breaking surge continues. The agency is trying to clarify its guidance for people who test positive but are asymptomatic or mildly ill. It stopped short of requiring those people to get a negative test before ending isolation after 5 days, saying if someone has access to a test and wants a test, they should, and those who test positive should isolate for another 5 days. But doctors say the recommendations still aren't clear enough.
It is confusing. It does feel like a bit of a choose your own adventure. If this, then this.
On top of dealing with the quarantine confusion, the CDC is set to meet this afternoon to consider booster shots for 12 to 15-year-olds. For nearly 2 years, we have been hearing how important it is to mask up to prevent COVID-19 from spreading. But with the new rapidly spreading Omicron variant, experts say cloth masks may not cut it anymore. Wendy Gillette has what you need to know to best protect yourself and those around you.
With the highly transmissible Omicron variant surging across the country, experts say it's time to upgrade the cloth mask.
The typical cloth mask might be 50% effective, and that was okay before. It doesn't seem to be enough with Omicron. We have special masks called respirators, such as an N95, that offer much greater protection. They're able to block 95% of particles that are either going out of your mouth or that you're breathing in.
Dr. Lindsay Marr with Virginia Tech studies how viruses move in the air. She says other respirators are also widely available.
Things like a KN95, which is a Chinese version of the US N95. It has ear loop straps and it's made out of a special material that's very efficient at filtering out particles. It also is designed to fit closely to your face. There's a South Korean version called a KF94 that some people call the boat-shaped respirator.
Three-ply surgical masks can also help prevent contact with infected droplets.
There are ways to really improve the performance of a surgical mask by improving its fit. One way is to use some little kind of clips or toggles on the ear loops so that you can tighten it up so it pulls closer to your face.
The fit is critical for all of these masks to ensure the strongest possible protection.
What you need is to have a good seal, especially around your nose, and you want to make sure there aren't gaps at the sides of your cheeks or at your chin.
As for kids, Dr. Marr says also choose a good mask that's comfortable with good fit and filtration. Some respirators are designed for kids, but N95s are not designed for younger children. Wendy Gillette, CBS News, New York.
Good information there. It's important to check that a regulating body in the U.S., Chinese, or Korean government has approved what you're purchasing. Counterfeit KN95 respirators are pretty prevalent, and the CDC maintains a list of brands selling counterfeit masks. New year, new you, new costs. Experts say 2022 is going to get expensive for a lot of us. A closer look why coming up at 12:15 as we take a live look from RView 11. Nathan, nice and sunny blue skies out there, but change is coming, huh?
That's right, Michael. A winter weather advisory has been posted for parts of Arkansas. I'll have the latest on that and who could see some accumulating snow, maybe some ice, next.